Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. For those of you who don't know me, my name is Muhammad Riovaldo Rajanugroho. I am the student of Faculty of Medicine in Sultan Agung Islamic University, Semarang, Indonesia. What I'd like to present to you today is what health problems with diabetes and how to deal with them. The topic is very important to be missed out. Diabetes may occur at any age, but diabetes rate rising in young people. That's why many children develop diabetes in early age. I'll begin by explaining the definition of diabetes, then I'll go on to the most common risk factors that could lead someone to get diabetes. After that, I'll move on to the side effects that come along with the diabetes. Finally, I'll offer some solutions to deal with diabetes and other health problems that come along with it. My presentation will take about 10 until 15 minutes. I'll be handing out copies of the PowerPoint slide to you by a link in the description box down below. So don't bother to screenshot if you want to read the PowerPoint. Just relax and pay attention to my explanation, okay? Feel free to ask questions at the comment section down below. Did you know that the number of people with diabetes rose from 108 million in 1980 to 422 million in 2014? Prevalence has been rising more rapidly in low and middle income countries than in high income countries. And diabetes, also a major cause of blindness, kidney failure, heart attacks, stroke, and numbness. Without any further ado, let's get started. Let's begin by the definition of diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood blood sugar, is too high. Over time, having too much glucose in your blood can cause health problems such as heart disease, nerve damage, eye problems, and kidney disease. Your body breaks down most of the food you eat into sugar and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body cells for use as energy. With diabetes, your body doesn't make enough insulin or can use it as well as it should. Hyperglycemia, also called raised blood sugar or blood glucose, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body systems, especially the nervous and blood vessels. Also, there's different of diabetes that have different causes, such as diabetes 1 or type 1 diabetes, previously known as insulin-dependent, juvenile or childhood onset, is characterized by deficient insulin production and requires daily administration of insulin, and type 2 diabetes, or formerly called non-insulin dependent or adult onset, results from the body's ineffective use of insulin. That's all I have to say to you about definition, and go ahead to the next content. Let's move on to the condition, behavior, or other factor that increases risk of diabetes. The first one is genetic. Family history of having a parent with diabetes can be one of the risks that can develop diabetes. Certain genes may make you more likely to develop type 2 diabetes. The disease tends to run in families and occurs more often in these racial or ethnic groups, such as African Americans, Alaska Native American Indians, Asian Americans, Hispanics or Latinos, Native Hawaiians, and Pacific Islanders. Second is lifestyle. Healthy lifestyle include losing weight if you're overweight, eating a healthy diet, and getting regular physical activity can prevent you from diabetes. Third Insulin resistance, a condition in which muscle, liver, and fat cells do not use insulin well. Overweight, obesity, and physical inactivity can make someone develop diabetes. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel diabetes. Meanwhile, physical inactivity makes body harder to lose weight and fat. That's all I have to say to you about the risk factors. And we move on to the next point. After talking about factors that increase the risk of diabetes, I'll move on to the side effects that come along with diabetes. Another complications besides diabetes itself can emerge in various body parts such as foot, eyes, and other organs. The complications that can show are stroke, blindness, kidney failure, nerve damage, feet problems, and etc. Let's move on to the next slide to explaining this matter further. The first one is stroke. Diabetes and heart disease often go hand in hand. Learn how to protect your heart with simple lifestyle changes that can also help you manage diabetes. Diabetes affects the body abilities to create insulin or use it properly. Since insulin plays an important role in pulling glucose into cells from the bloodstream, people with diabetes often have too much sugar in their blood. This can lead to a stroke. Without rapid treatment, a stroke can result in permanent cell damage or death. How diabetes affect your heart? Over time, high blood sugar can damage blood vessels and the nerves that control your heart. People with diabetes are also more likely to have other conditions that raise the risk factor of heart disease. High blood pressure increases the force of blood through your arteries and can damage artery walls. Having both high blood sugar and diabetes can greatly increase your risk for heart disease. Too much LDL or bad cholesterol in your bloodstreams can form plaque on damaged artery walls. High triglycerides and low HDL cholesterol or high LDL cholesterol is thought to contribute to hardening of the arteries. These lifestyle changes can help lower your risk for heart disease or keep it from getting worse, as well as help you manage diabetes. Follow a healthy diet, eat more fresh fruit and vegetables, lean protein, and whole grains. Eat fewer processed food such as chips, sweets, and fast food, and avoid trans fat. Drink more water, fewer sugary drinks, and less alcohol. Aim for a healthy weight. If you're overweight, losing even a modest amount of weight can lower your triglycerides and blood sugars. Modest weight loss means 5% to 7% of body weight, just 10 to 14 pounds for a 200-pound person. Get active. Being physically active makes your body more sensitive to insulin, the hormone that allows cells in the body to use blood sugar for energy, which help manage your diabetes. Physical activity also helps control blood sugar levels and lowers your risk of heart disease. Try to get at least 150 minutes per week of moderate intensity physical activity, such as brisk walking. Manage your ABCS. A is get a regular A1C test to measure your average blood sugar over 2 to 3 months. Aim to stay in your target range as much as possible. B is try to keep your blood pressure below 140 per 90 millimeter Hg. And C, manage your cholesterol levels. S, stop smoking or don't start. Manage stress. Stress can raise your blood pressure and can also lead to unhealthy behavior, such as drinking too much alcohol and overeating. Instead, visit a mental health counselor, try meditation or deep breathing, get some physical activity, or get support from friends and family. The next side effect is blindness. Diabetes is an important cause of blindness and occurs as a result of long-term accumulated damage to the blood vessels in the eyes. This common eye disease is the leading cause of blindness in working age adults. Diabetes can damage your eyes over time and cause vision loss, even blindness. The good news is managing your diabetes and getting regular eye exams can help prevent vision problems and stop them from getting worse. This common eye disease is the leading cause of blindness in working age adults. Diabetic retinopathy is caused when high blood sugar damages blood vessels in the retina. Damaged blood vessels can swell and leak, causing blurry vision or stopping blood flow. Sometimes new blood vessels grow, but they aren't normal and can cause further vision problems. Diabetic retinopathy usually affects both eyes. The longer you have diabetes, the more likely you are to develop it. These factors can also increase your risk: blood sugar, blood pressure, and cholesterol levels that are too high. Smoking, race or ethnicity, such as African Americans, Hispanic or Latinos, and American Indians or Alaska Native are at a higher risk. Treating diabetic retinopathy can repair damage to the eye and even prevent blindness in most people. Treatment can start before your sight is affected, which helps prevent vision loss. Options include is laser therapy. This creates a barrier of scar tissue that slows the growth of the new blood vessels. As a medicines called VEGF inhibitors, which can slow down or reverse diabetic retinopathy, removing all parts of the vitreous, reattachment of the retina, and injection of medicines called corticosteroids. The third side effect is kidney failure. Diabetes affects the kidney's ability to do their usual work for removing waste products and extra fluid from your body. Each kidney is made up of millions of tiny filters called nephrons. If you are diabetes, get your kidney checked regularly, which is done by your doctor with simple blood and urine tests. Regular testing is your best chance for identifying CKD early if you do develop it. Early treatment is most effective and can help prevent additional health problems. Over time, high blood sugar from diabetes can damage blood vessels in the kidneys as well as nephrons, so they don't work as well as they should. Many people with diabetes can also develop high blood pressure. Many people with diabetes also develop high blood pressure, which can damage kidneys too. This disease usually don't this This disease usually doesn't have any signs or symptoms in the early stages. You won't know you have it unless your doctor checks you for it. You can help keep your kidneys healthy by managing your blood sugar, blood pressure, and cholesterol levels. This is also very important for your heart and blood vessels. High blood sugar, blood pressure, and cholesterol levels are all risk factors for heart disease and stroke. Keep your blood sugar level in your target range as much as possible. Get an A1C test at least twice a year, more often if your medicine changes or if you have other health conditions. Talk to your doctor about how often is right for you. Check your blood pressure regularly and keep it below 140 per 90 mmHg. Talk to your doctor about medicines and other ways to lower your blood pressure. Stay in your target cholesterol range. Eat food lower in sodium. Eat more fruits and vegetables. Be physically active. and take your medicines as directed. The fourth one is nerve damage. High blood sugar damages your nerve, and this nerve may stop sending messages to different parts of your body. Nerve damage can cause health problems ranging from mild numbness to pain that make it hard to do normal activities. High blood sugar can lead to nerve damage called diabetic neuropathy. You can prevent it or slow its progress by keeping your blood sugar as close to your target range as possible and maintaining a healthy lifestyle. Nerve damage is one possible complication from having high blood sugar levels for a long time. High blood sugar damages your nerve, and this nerve may stop sending messages to different parts of your body. Nerve damage can cause health problems ranging from mild numbness to a pain that makes it hard to do normal activities. Half of all people with diabetes have nerve damage. The good news is that you can keep or you can help prevent or delay it by keeping your blood sugar as close as your target level as possible. When you do this, you'll also have more energy and you'll feel better. How to prevent? Keeping your blood sugar as close to your target range as possible is the best way to help prevent or delay nerve damage. Other things you can do are keep your blood pressure below 140 per 90 mmHg, get regular physical activity, lose weight if you're overweight, limit or avoid alcohol, stop smoking or don't start, follow a healthy eating plan, and take medicines as prescribed by your doctor. About half of all people with diabetes have some kind of nerve damage. You can have nerve damage in your part of your body, but nerve in your feet and legs are more often affected. Nerve damage can cause you to lose feeling in your feet. Some people with nerve damage may have numbness, tingling, or pain, but others have no symptoms. Nerve damage can also lower your ability to feel pain, heat, or cold. If you have diabetes, here's a way to keep standing on your own 2 feet. Check them every day, even if they feel fine, and see your doctor if you have a cut or blisters that won't heal. Anyone with diabetes can develop nerve damage, but these factors increase your risk. First one is blood sugar level that are hard to manage. Having diabetes for a long time, especially if your blood sugar is often higher than your target levels, being overweight, being older than 40 years, having high blood pressure, and having high cholesterol. Tips for a healthy feet. Check your feet every day for cuts, redness, swelling, sores, blisters, corns, calluses, or any other change to the skin or nails. Use a mirror if you can see from the bottom of your feet, or ask a family member to help. 2 is wash your feet every day in warm water. Don't soak your feet. Dry your feet completely and apply lotion to the top and the bottom, but not between your toes, which could lead to infection. Never go barefoot. Always wear shoes and socks or slippers, even inside, to avoid injury. Check that there aren't any pebbles or other object inside your shoes and that the lining is smooth. Wear shoes that fit well. For the best fit, try on new shoes at the end of the day when your feet tend to be largest. Break in your new shoes slowly, wear them for an hour or two a day at first until they are completely comfortable. Always wear socks with your shoes. Trim your toenails straight across and gently smooth any sharp edges with a nail file. Have your foot doctor trim your toenails if you can see or reach your feet. Don't remove corns or calluses yourself. And especially, don't use over-the-counter products to remove them. They could burn your skin. Get your feet checked at every healthcare visit. Also, visit your foot doctor every year for a complete exam, which will include checking for feeling and blood flow in your heart, in your feet. I'm sorry. Keep the blood flowing. Put your feet up when you're sitting and wiggle your toes for a few minutes several times throughout the day. Check your fit-friendly activities like walking, riding a bike, or swimming. Check with your doctor about which activities are best for you and any of you should avoid. Be sure to ask your doctor what else you can do to keep foot healthy. Over time, blood sugar levels that are too high or too low can damage nerves that affect your hearing. Learn how Learn how you can help prevent hearing loss if you have diabetes. Diabetes can lead to nerve damage that affects many parts of the body, including your hands, feet, eyes, and kidneys. Diabetes can also cause nerve damage in your ears. Over time, high blood sugar levels can damage small blood vessels and nerve in the inner ear. Low blood sugar over time can damage how the nerve signals travel from the inner ear to your brain. Both types of nerve damage can lead to hearing loss. How to protect your ear? You can reverse hearing loss, but you can't I'm sorry, you cannot reverse he- you cannot reverse hearing loss, but you can follow these tips to help protect your ears. The first one is to keep your blood sugar as close as your target levels as possible. So two, get your hearing checked every year. Avoid other causes of hearing loss, including loud noises. Ask your doctor whether any medicines you're taking can damage your hearing and what other options are available. You should have your hearing tested audiologist by an audiologist external icon when you first find out you have diabetes and then every after year. Make it part of your diabetes care schedule. If you think you have hearing loss, talk to your doctor. They can help you to decide if you should see an audiologist. A healthy mouth it is important for everyone, but high blood sugar can make it harder to keep your mouth healthy. If you have diabetes, learn how you can avoid oral health problems and keep a smile on your face. If the sugar level is high in your blood, it's high in your saliva too. Bacteria in plaque, a sticky film use sugar as food. Some of these bacteria can cause tooth decay, cavities, and gum disease. If the tooth is not treated, it can also lead to tooth loss. Gum disease can be more severe and take long to heal if you have diabetes. If you have gum disease, your diabetes may be harder to manage. Here's a quick look at how diabetes can take its toll on your oral health. You may have less saliva, causing your mouth to feel dry. Your gums may become inflamed and bleed often. Infections in your mouth can take longer to heal. Let's keep our mouth happy and healthy. Regular dental visits are important to prevent problems. Follow your diabetes care schedule. Follow your diabetes follow your diabetes follow your diabetes care schedule. Keep regular dental visits for professional cleanings, x-rays, and checkup. Ask your dentist how often you should have your cheek how Ask your dentist how often you should have your teeth checked. Here are a few more important tips. Bru- Brush your teeth at least twice a day with fluoride toothpaste. Floss your teeth at least once a day. Tell your dentist if you have diabetes. If your gums are red, swollen, or bleed easily, see your dentist. This may be signs of gum disease. Other signs include dry mouth, loose teeth, or mouth pain. If you smoke, quit. Smoking increases your risk of gum disease and can worsen your diabetes. Is mental health pretty low on your list of priorities for managing diabetes? This may change your mind. Mental health affects so many aspects of daily life. How you think, feel, and handle stress, relate to others, and make choices. You can see how having a mental health problem could make it harder to stick to your diabetes care plan. Depression is a medical illness that causes feelings of sadness and often a loss of interest in activities you used to enjoy. It can it can get in the way of how well you function at work and home, including you aren't able to manage your diabetes well. Your risk goes up for diabetes complications like heart disease and nerve damage. You may sometimes feel discouraged, worried, frustrated, or tired of dealing with daily diabetes care, like diabetes is controlling you instead of the other way around. Maybe you've been trying hard but not seeing results, or you've developed a health problem related to diabetes in spite of your best effort. Those overwhelming feelings, known as diabetes distress, may cause you to slip into unhealthy habits, stop checking your blood sugar, even skip doctor's appointments. Diabetes distress can look like depression of anxiety, but it can be treated effectively with medicine. Instead, these approaches have been shown to help. First one is to make sure you're seeing an endocrinologist for your diabetes care. He or she is likely to have a deeper understanding of diabetes challenges than your regular doctor. Ask your doctor to refer you to a mental health counselor who specializes in chronic health conditions. Get some one-on-one time with a diabetes educator so you can problem solve together. Focus on one or two small diabetes management goals instead of thinking you have to work on everything all at once. The last point is some solutions to deal with diabetes and other health problems that comes along with it. The first one is exercise regularly. With doing at least 30 minutes of regular exercise activity on most days, we can control the risk of diabetes, where activity is required for weight control. Next solution is healthy diet. We have to eat a healthy diet, avoiding sugar and saturated fats to control the risk of diabetes. The last solution is avoid tobacco use. Smoking increases the risk of diabetes, heart disease, and it also bad for your lungs. So, we have come to an end of the presentation. Diabetes is a disease that occurs when your blood sugar is too high and your body cannot process it at all. The common risk factors are genetic, lifestyle, overweight, obesity, and physical inactivity. Diabetes can also cause some complications such as stroke, blindness, kidney failure, and numbness. But we can reduce it by having a healthy diet, exercise regularly, and avoid smoking. As Ralph Waldo Emerson once said, the first wealth it is health. So we have to keep your so we have to keep our body health so we have to keep our body healthy anytime. Don't forget to eat more healthy foods. Okay, this is the last. If you're curious about where I get the references for the presentations, just see it on the screen or check the description down below. Alright, we have come to the end of the presentation. Let me know if you have something to ask in the comment section down below. That's all from me. Thank you and see you later. Goodbye.